Dr. Peeples, when did you implement your EHR system?
Well, I'm at Premier Medical Group, and we were Jackson Medical Clinic when we first went to EHR, and that was in 1995. We were one of the first groups in the country to do that. There were some people out in Oregon that beat us to that year. I think it was that same year, but we were very early on in the electronic health record movement. And not only did we implement that, and that system was a DOS-based system, which a lot of people won't even remember DOS, but it was a great system, and it was very simple and streamlined and easy to use, and it did a lot of the things you needed to do, but it lacked functionality. And so fairly soon after that, we converted from the DOS system to a Windows-based system. Again, it was a big transition to that system. A little later after that, we actually converted to another EHR system, which we've stayed on till this day. Several years ago, though, it's probably been about 10 years ago, we went on that system's financials as well, their practice management system. And that was not as successful as we would have liked for it to be, so we added another practice management system but it remained on the same EHR since that time.
Did you think EHR adoption would be beneficial to your practice when it was first implemented?
Well, I was on the committee at the original IT committee at our clinic when we started. Knew very little about computers and knew even less about electronic health records. And I really thought at that time that we were ahead of the curve and that we should wait until more time had passed. But I would say I'm glad that we went ahead and did it. The main reason is the earlier you start collecting electronic data, then the better you are. And I think we really were ahead of the curve, and you can see that by us going to a DOS system that had to be upgraded in just a few months to a Windows system. We probably should have waited, but we collected that 6 months of electronic data, and the more electronic data you can have, the better you are going into the future with whatever system you end up with.
What were the biggest challenges you faced when implementing your EHR system?
Well, by far the biggest challenge is attitude, and if the doctors come in or the administration comes in with the attitude this is not going to work, this won't be helpful to me, it won't be helpful to my patients, then you're going to have trouble. And so you have to start building up the proper attitude early on, and you have to keep a positive attitude, and rather than saying I'm going to look for as many problems as I can find with this system, you have to say, I'm going to figure out how to make this work for me and my patients. And by far, the biggest obstacle people have with EHRs is the attitude that they have. But cost is a huge problem. And now the meaningful use money can soften that hit some, but it is an expensive thing to switch from paper charts to electronic health records, and part of the reason is when you switch, you have to run two systems simultaneously. So you have to have charts because you're still going to need access to that information about the patients. You're not going to have it all in an electronic format at that point, and you're going to have still a medical record staff that pulls charts, but also you're paying for this electronic system. And that costs you a lot of money up front. You also lose money on production because there's no way to see as many patients when you move to any type of new system as you were seeing on a system that you were used to. And so you could expect to start with seeing about half the number of patients you usually see, at least for the first few days. And then you may be able to move back up to almost as many patients as you usually see within the first week or two, although you're going to work longer hours. It just takes you longer when you're learning a new system. Cost, will continue to be a problem, unfortunately, in my opinion, for several years. You may get back up to your full production within a fairly short period of time, but you have to work longer. You're paying for two systems, but the break point is usually about 6 months. You have seen most of your patients one time, and that's where most of the work occurs in putting new information into the system, and it slows the system down. Once you have that information, though, in the system, it speeds things up. And after a year, I think that at our clinic, we saw the cost of paying employees get back down to the pre-implementation level. So at about a year, we got our production costs back down to about the same amount. It took several years to really realize the full benefit financially, though, of the electronic health record. And today, I see more patients than I ever saw before on a paper chart, and I get home earlier. And so I'm fully convinced that it helps you financially. And that was without any meaningful use money or anything. That was us borrowing money from the bank to pay for the system and then paying that off over time. Even without meaningful use money, it became a profitable situation for us, but it takes a long time and it requires a lot of patience. So attitude is very important. Cost is very important as challenges that have to be overcome. When we first started, downtime was a very big challenge, and the system would go down frequently. It was very frustrating. It was not good medicine. But the systems today are much more robust, have much more redundancy built into them so that they don't go down nearly as often. We haven't been down I'd say, in the last several years. And so I feel very confident about the stability of the systems now as opposed to when we first implemented the process. So those would be several of the challenges that I think that we faced.